Well, good morning, everyone. And on behalf of the University of Wisconsin-Madison's Global Health Institute, I would like to welcome you to our first event of a four-part webinar series entitled COVID and Equity, What We've Learned and Where We Go From Here. My name is Kaylin Ostrowski, and I have the good fortune of serving as Director of Advancement for the Global Health Institute and Strategic Advisor to our Planetary Health Scholars Program. For those of you who are new to the Global Health Institute, we are a unit that works across campus at the University of Wisconsin-Madison, dedicated to improving and inspiring collaboration, educating tomorrow's leaders, and promoting research and outreach to improve well-being for all. GHI works at the intersection of health, equity, and sustainability. Our work is grounded in a global health ethic that recognizes the health of humans, animals, and the planet's ecosystems are inextricably linked. We work locally and globally, and our team has been involved in the COVID response from frontline care to policy advice. We developed the COVID and Equity webinar series in response to the significant health disparities illuminated by the pandemic, both in Wisconsin and across the world. The challenges of equity and systemic racism have been further magnified as protests over the death of George Floyd and others from police brutality have reignited a movement for justice locally and globally. GHI has brought together a diverse group of campus, community, and international voices to examine the lessons we've learned from the pandemic and to translate these lessons learned into actionable next steps for policymakers, program managers, and researchers moving forward. Today, we welcome three incredible voices from Wisconsin. Unfortunately, Lisa Payton-Kerr, CEO and founder of the Foundation for Black Women's Wellness, is no longer able to join us this morning due to a last-minute conflict. But we are very excited about our panelists who have worked with and been part of communities impacted by inequities. They will discuss poverty, race, and health, examine who's at risk, who receives care, and how we can develop effective, equitable, and sustainable partnerships that respect communities and advance their well-being. Before we get started, a couple of housekeeping items. I'd like to remind everyone that the session is being recorded, and a link to the archived video along with an event summary will be available on our website. If you would like to ask the panelists questions, please type your question into the chat box by clicking on the word bubble icon at the bottom. I'd also like to thank everyone who helped organize the event, as well as our moderator, panelists, and partners in the UW Population Health Institute. Now, without further ado, I'd like to introduce our moderator, Dr. Sheri Johnson, Director of the UW-Madison Population Health Institute. Dr. Johnson has dedicated her career to partnering with children, families, and community organizations and systems to advance health and well-being. She sees the resilience of individuals and communities and works to remove unfair obstacles and conditions that create and perpetuate health inequities. Dr. Johnson earned her PhD in clinical psychology at Boston University and served as clinical fellow at Harvard Medical School. Prior to joining UW, she served as a state health officer at the Wisconsin Division of Public Health and as Associate Professor of Pediatrics at the Medical College of Wisconsin Center for Advancement in Underserved Children. Thank you, Sheri, for your leadership, and to the Population Health Institute for partnering with us on today's critical discussion of COVID inequity, improving health disparities in Wisconsin. Sheri. Sheri, you're muted. We can't hear you.
Now you can hear me. Okay. I was saying thank you very much for the opportunity to be part of this really important conversation, and wishing Lisa Payton-Kerr well, and already missing her contributions to this conversation that we will be having. So It's my pleasure to introduce the two panelists that are able to join us, and we'll start by introducing Paula Tran Inzeo. Paula Tran Inzeo is the director of the Mobilizing Action Towards Community Health, or MATCH group, in the Population Health Institute. Her work focuses on topics of health equity and health equity capacity building, collective community action, power building, and health in all policies. She served as the Health Promotion State Specialist at UW Extension, Assistant Director at the UW-Madison Center for Community and Nonprofit Studies, Founding Coordinator of Thrive Wisconsin, and Founding Chair of the Wisconsin Public Health Association Impact Assessment and Health in All Policies section. She earned her master's in public health at UW-Madison and is a doctoral candidate in the School of Human Ecology. Our second panelist is Lakita Maulson. She is a fourth-year medical student at UW-Madison and is in the Wisconsin Academy for Rural Medicine, or WARM. She is a member of the Flambeau Ojibwe Nation. She became the first in her family to graduate with a Bachelor of Science degree from UW-Madison and joined Dr. Carla Pugh's Simulation and Engineering for Surgical Education Lab. She hopes to work as a family medicine physician within a tribal community in the future. So we are clearly in for a wonderful conversation and learning opportunity. The goals are to leverage voices and expertise and diverse perspectives to advance these issues of critical importance. And so my sort of opening job is to frame the conversation a bit and share some overarching thoughts about the ways that COVID-19 is laying bare longstanding and underlying inequities and opportunities for everyone to be healthy. So let me just start by sharing some recently published data from our colleagues in the School of Medicine. Wisconsin's health ranking as a state has been dropping, according to a recent analysis conducted by Dr. Odalichi Nzenwane and Drs. Crawford and Remington, published in the Wisconsin Medical Journal. And the authors report that Wisconsin's health ranking dropped from the 7th healthiest state in the nation in 1990 to 23rd in 2018. They demonstrate in their analysis that the greatest declines in ranking were related to infectious diseases, infant mortality, and smoking. And it's notable that those rankings related to infectious disease predate the current COVID-19 pandemic. The authors conclude that there is a necessary call for action to address the root causes. So when we think about what those root causes are, we think about some of the work that the Population Health Institute has been known for many years, for moving the conversation forward from understanding health as being produced by health care and individual behaviors to a broader understanding that the social and economic factors that are present in communities are significant drivers of how long and how well people live. And we know that even though social determinants of health are yet an incomplete explanation of the ways in which people's opportunities to be healthy differ due to the place where they live, the color of their skin, the groups that they're assigned to or that they belong to, and importantly that those conditions, social and economic conditions, are also driven by historical and ongoing policy and practice. Those policies and practices are then rooted in an even deeper set of conditions related to power. Basically, who has the say-so to make policy and practice? Who has the say-so to decide the ways in which policy and practice is implemented? And how are those decisions influenced by larger systems of oppression, such as racism, sexism, heterosexism, classism, colonialism? So that is what we hope to dive into today in our conversation, and I hope that those sort of big picture ideas are going to foster some conversation as we listen to these presentations. I want you to be thinking in advance not only about the measured differences in groups' outcomes, whether it's length of life or quality of life, but really be thinking about how these differences emerged, why they emerged, and what it will take for us now to create a just and fair society that recognizes and includes and supports everyone's opportunity to thrive. Consider, for example, how the failure to uphold laws and treaties respecting the rights of Native nations and people are impacting the current disproportionate burden of COVID-19. Consider how systemic racism in labor and employment, housing, bank lending, and criminal justice are resulting in disproportionate impacts for African Americans and Latinx communities. Consider how disinvestment in local and regional economies and privileging of powerful moneyed elites is impacting rural and urban economies and opportunities for health. So with that, I'd like to invite Paula Tran Inzeo, our now first speaker, to share her 5-minute flash talk. So Paula, you have the floor.
Thanks so much, Sheri. And thank you to the GHI team for having us and for getting our slides launched. So as Sheri mentioned, I have the great privilege of working with her at the Population Health Institute, and I direct the Mobilizing Action Toward Community Health group. In our work, we think of our functions and our efforts through 3 hubs of action. And our goals are really to think about how we continue to evolve our practices across the state and in the field of health equity and public health, how we really focus our priorities, and how we shift power to support collective action on root causes of health and equity. As Sheri said, we really believe that power is one of the root causes that then shape our social determinants and really ultimately shape our outcomes. So these hubs, in order to reach these goals of evolving practice, focusing on priorities and shifting power, include training and technical assistance, where we support the capacity building of practitioners and community leaders and policymakers to really think about how their practices need to change day to day in order to support advancing health equity. We also engage in statewide alignment to bring partners across the state together to identify shared priorities around the work. And I'll list some examples of each of efforts happening in each of these hubs. And then lastly, engage research and development. We know that our practices are fundamentally tied to our ability to engage in scholarship and vice versa. So we value the dynamic exchange between research in relationship with communities and those that are at the forefront of movement work to ensure that our research is in response to and in support of movements around the country and around the state advancing health equity. Next slide. So some examples of the work that we do within our training and technical assistance, we have workforce programs. One of the flagship programs in that particular hub is our Wisconsin Population Health Service Fellowship Program, and we have a range of community training programs, including a community teams training program and a coach program, which is an alumni program that supports folks that have been engaged in coalition building to move their work towards policy. In the statewide alignment hub, we've done work around the state to really, alongside several other organizations, to support efforts to declare racism a public health crisis, support tightening our work to define and move ahead a health equity narrative, support resources and tools to get closer to a shared health equity set of policies and policy agenda. We've been engaging partners on how we can best, as agencies and institutions, work alongside leaders to really center voices of those most impacted by inequity. And we engage in a host of network development to continue aligning alliances and coalitions. One of those networks, for example, is around coordinating community health workers around the state. And then in our Engaged Research and Development Hub, we engage in a whole host of activities across translating data into action, thinking about the use of tools to support health and health policies like health impact assessment, and then partnered research around a range of social determinants like incarceration, housing, community development, and around rural thriving. Next slide. And so over the past several months, many of our team members have had the privilege to be working in partnership with the state COVID-19 response. Many of us have been formally reassigned and now are really knitting together the work that we've been doing within what's called the Community Resilience and Response Task Force alongside the work that we do within the Population Health Institute. So this work has been in partnership with various state agencies. The state response has stood up all state agencies to be partners in the response led by the governor's office. And our goals within the Community Resilience and Response Task Force aims to really embed community resilience, equity, and mental health perspectives across our current response, and also take this opportunity to plan for a just recovery. As Sheri mentioned, we know that going back to normal is not necessarily the desired state for those that want to advance health equity. Our pre-COVID life included structures that reproduced inequity. So wanting to take this opportunity with a bright light shined on the inequities that have been exacerbated by the pandemic to really think about opportunities to seed policies that will support sustained just recoveries for communities. Our work in the Response Task Force, which we call CERTIF, has really focused on individuals and families living in congregate settings. And you'll see, if you're watching the slide, several different sector-based areas that we've been engaged with across the response over the past several months. It also includes a targeted focus on those individuals that have had limited access to what we call functional and access needs. And we've defined that as limitations related to transportation, challenges around accessing food, safe housing, language access, cultural considerations, civic participation, information channels, really all these systems that weren't working well for many Wisconsinites before the pandemic. And then also across critical services workforces. We know that many people have been working throughout the duration of the pandemic. So essential workers and newly deemed essential workers that have been really at the forefront of allowing our systems to continue to function. And they've put their lives in danger to do that work. So we've been engaging with sectors to really support their needs during this time, as well as really consider how our response can adjust in the short term and the long term to think about just recovery. One example of the work, I'll lift up the work that we've done with spiritual leaders. We regularly meet with spiritual leaders to engage with them around their expertise of what they're experiencing locally, but also share resources related to infection prevention and control, and also support shared messaging around what we can do as a collective community in the state to address issues that they're finding in their communities. So these sector-based groups have been dynamic channels of exchange of information and expertise in order to support the work of sectors across the state to be a part of the response as well. Related to racial equity, we've been partnering with the governor's office to identify needs and channel resources, and we're hopeful to really expand on that effort statewide to increase the level of culturally responsive communications to communities of color across the state, as well as support investments in local innovations around supporting a just recovery. So more to come on that, but we're really excited about some things we're cooking up with our partners across the state.
Thank you for that, Paula. And I know there'll be a lot of questions about how that framework developed in the ways that you are infusing health equity principles and best practices as you help the state move toward just recovery. So I would now invite Lakita Maulson to share her 5-minute flash talk, and then we'll have some moderated dialogue and hopefully some questions from our participants. So Lakita, please take the floor.
Thank you, Sheri, and thank you, Paula, for sharing that. And thank you to the GHI team as well for having myself on here. So I'm Lakita, as was said, I'm a fourth-year medical student. I'm actually on rotation at the Ho-Chunk Department of Health at the House of Wellness in Baraboo, Wisconsin. And so I'm kind of actually filling in for my attending, who is Dr. Amy DeLong, because she couldn't make it today. And she wanted me to relay that she's very excited that Indigenous communities are a part of this conversation and that this is something that we are able to speak about on this platform. So in terms of, I'm a medical student. I'm also the national president of our Association of Native American Medical Students. So I've kind of got a pulse, at least across the country a little bit, in terms of how students across the country are viewing COVID-19, but then also within the Ho-Chunk House of Wellness and the Ho-Chunk Nation over this past month of being on rotation. As was mentioned, I'm also an Ojibwe tribal member of the Lakita Flambeau Nation in northern Wisconsin. So I feel like I have a decent idea of Indian country, and in terms of talking about this a little bit. So if we could go to the next slide. So this was actually just pulled yesterday, and when looking at the numbers, specifically looking at American Indians, this is the statewide data for number of COVID cases in Wisconsin. And as you can see, American Indian, we are at 438 cases as of yesterday, and number of deaths at 10. And you can see how that compares to other communities of color, including Asian, Pacific Islander, Blacks, whites, and then multiple races. One thing that Dr. DeLong and myself and others that I've talked to in terms of Native mentors across the country, one thing we find really challenging with the statewide data and data anywhere is that oftentimes we find ourselves usually in an other category. So it's really great that American Indians have their own category, first of all, but the challenging part is the multiple or other races. So oftentimes we have individuals in our communities who are American Indian as well as other races. So having that split out in terms of what does multiple or other races mean is something that is needed necessarily, especially in terms of trying to learn more about how exactly are American Indian communities, as well as Black and Asian or Pacific Islander communities, more affected versus others, because people do identify within multiple groups. Or even in terms of asking, what group do you mainly identify with, rather than having a multiple or other group, is something that we talked about yesterday in terms of this specific data. But we're at least not in an other group, which is really great, first of all. So in terms of, you can go to the next slide. So in Wisconsin specifically, we have 11 federally recognized tribes. Across the country, we have over 570 federally recognized tribes. So in terms of a state, we actually have quite a few tribal communities in Wisconsin. And as you can see, they're really spread out, especially the Ho-Chunk Nation. So the Ho-Chunk Nation is actually spread out within 15 different counties, and they have two main clinics, which is one that I'm at right now, which is the Ho-Chunk House of Wellness in Baraboo, Wisconsin, and then they have a clinic up in Black River Falls, and then they have 4 other satellite sites throughout their communities. And so as you can imagine, coordinating care across all of this and trying to track COVID-19 throughout these communities is sometimes a challenge, but fortunately for the Ho-Chunk, they're actually connected to the state database, which I hope other tribes in Wisconsin are as well. I can't say that I know for sure, but if they're not, that's something that should be addressed, because obviously it's easier to track and address this when you have a coordinated effort. And when in terms of things that were initially challenges from what I was hearing across the country from other students and mentors is that initially tribes didn't have, so tribes have typically their own epidemiology centers, and working with those tribal epidemiology centers is key. And that wasn't something that was initially occurring, and tribes were having a really hard time accessing data on COVID-19 initially. It sounds like, at least within the Ho-Chunk Nation, this has been addressed really well, and they're connected to the statewide database and working within the web system, which is great. But that is something that if all tribes or the tribal epidemiology centers don't have access to, then that's something that could have the potential for improving the response to COVID-19 within tribal communities. And I just wanted to showcase like this picture just to kind of show you that they are really spread out. And within this area, specifically the Tribal Epidemiology Center in Wisconsin that typically you would want to work with, which is the Great Lakes Intertribal Epidemiology Center, which is actually currently based where I live in Flambeau, so up north. But they work with all of the tribes in Wisconsin, as well as I think up into Michigan as well, and even across the Bemidji area, which is the Bemidji area, for those who aren't aware, the Indian Health Service, which is the main service provider of health care to tribal communities, has specific areas that they split up the United States into. And so the Bemidji area encompasses Minnesota, Wisconsin, and Michigan. And so across that area, the Great Lakes Intertribal Epidemiology Center is kind of the main tribal epidemiology center for the region. And so as you can imagine, there's a lot of other tribes in Minnesota, there's a lot of other tribes in Michigan. So again, coordinating efforts is a challenge and something that needs to be addressed in terms of moving forward. You can go to the next slide. So in terms of specific responses, like I said, I'm at the Ho-Chunk Nation right now, and so I can speak towards this really well with talking to Dr. Zalong. And the things that the Ho-Chunk Nation has done recently to try to address inequities within their community is access to testing. So they have increased the amount of testing that they've been able to provide to tribal members and or their employees. And they have drive-up testing that's available every day at the Ho-Chunk House of Wellness and their Black River Falls, Black River Falls clinic, sorry. And then they are alternating every few weeks doing a community-wide testing available at their other satellite sites too, which has been really great. And they're also contact tracing and doing their own contact tracing. Specifically inputting data into the Wisconsin infectious disease tracking website and making sure that they are able to track down families that have been affected by COVID. One thing with contact tracing that has been noticed specifically for their community is that typically the cases that they have had are associated with family gatherings of sorts. And I feel like this is very common in multicultural communities in general, where communities are really closely tight-knit. You have multi-generational individuals living in one single home, and also visiting and meeting up with family members is something that is just a cultural aspect. I think about my own family, which is very, very large, and birthday parties are a big thing, cultural events are a big thing, and just stopping those all together is something that's very challenging for our communities to just all of a sudden stop. Although I think in terms of educating the community about the importance of trying to limit contact is something that they're also increasing along with the contact tracing. Medication management, Ho-Chunk has always been really great about mailing their medications, even prior to COVID actually. So they have a really big population base who come up to the community and visit their clinics. And usually you just have to have one annual visit with the clinic to then have your prescriptions provided and mailed to you, even across the country to Arizona and such. So this was something that Ho-Chunk was already set up with prior to COVID, and it's something that's just increased in use ever since COVID. So that's something they were already really doing a good job at. So that was, in my opinion, that's something that's really great and would be great for other tribal nations to also do if they can, and or provide, others can help provide support for something like that. Social services are something that they're also increasing and providing access to, at least online, and then specifically transportation to and from appointments is still something that's available for tribal community members. Food delivery, so food security is something that they're still working on. They have food drives every Friday within their specific system. Even having food drive-up food service in cities where their tribal members may be, which include Milwaukee, the Twin Cities, and Chicago. So they're really able to do quite a bit for their nation, which is pretty exciting. However, one thing that I want to mention specific, we can go to the next slide actually, because that kind of ties into my next point. So in terms of best practicing with tribes, the biggest thing you need to keep in mind is that they're all different, and funding for each tribe is very different. So while the Ho-Chunk Nation is able to provide all of this for their community, not every tribe is able to. Not every tribe has the funds to. Not every tribe has the support to. The government structures are all different for each tribe. And so collaboration is going to be really key in terms of working with communities, even within the Wisconsin state. So again, we have 12 tribal communities in the state. 5 of them are Ojibwe nations, but even those 5 bands of Ojibwe have their own tribal governments, and they run very differently compared to the other tribal communities. So being willing to collaborate and come into those communities and work with the appropriate individuals, specifically the health departments and then the tribal councils, is going to be really key in terms of working with tribal communities and being flexible and understanding that tribes are very different. And then visibility is key, and so that's kind of going back to those stats again and making sure that we are making sure we understand who is being tested, how did they identify, are they American Indian, or where exactly, what tribe may they be associated with. Even if they're living in Milwaukee, it's good for Ho-Chunk to know that they have a tribal member or a tribal individual in Milwaukee that is actually who tested positive for COVID. And so they have a much better understanding of their impact. And then one other thing Dr. DeLong really mentioned in terms of trying to decrease inequities within these communities is the idea of moving towards like a hybrid education system coming up potentially, and access to resources for children in poverty or in rural settings where they don't have access to internet and such. So providing and finding, she said she doesn't have the answer to this, and I don't necessarily either, but finding ways to provide support for students who are in rural areas, which Wisconsin is a big rural area. I'm a WARM student, which is the Wisconsin Academy for Rural Medicine. And I've seen, I lived rurally even myself, so providing access to individuals in rural areas and those in poverty, making sure they have access to internet, just even for basic education, is really key, because we don't want to increase the gap in education that already exists in this state. And that's not just for American Indian communities, that's for all multicultural communities, including Black and African American and Asian and Hispanic. So that's kind of something that she thinks is really key, and I agree that it's key that we think about those types of things moving forward. And I think that's the big things at this point.
Thank you so much for both of those presentations. And I think that final point that you made, Lakita, is really one that I'd like to start the panel discussion around. So this idea that the current COVID pandemic is magnifying the existing inequities and opportunity. So your example of the absence of educational opportunity for young people who might be living in high poverty school districts, or young people who are in school districts that don't have adequate resources to make the rapid pivot to online or hybrid learning. So we're seeing this magnification of inequity across a number of sectors during the COVID pandemic. What are some thoughts that either one of you have about how we prevent gaps from widening as we move through phases of response and recovery?
Yeah, I can. We've been doing a lot of thinking about this, and I think it's to sort of lift up some of the points that Lakita also made, that communities aren't monolithic, right? That communities have very unique attributes across place, across race, across dynamics, and across assets and resources. So one of the things that we've really been thinking about is this concept of targeted universalism, right? What are the ways that we can think about our shared goals as a state and really make sure that we implement in a way that is responsive to a local community's history and assets and desires. So some of the tools that we've put together help communities suss out, what's the nature of their disease activity and what's the risk they might be experiencing from sort of an infection prevention standpoint, and also what are the resources and assets that they have to adjust and mitigate, while also holding the sort of equity considerations that are also very specific to communities that include social, economic, environmental, educational equity implications for the people and families in their communities, and then what are the mitigation strategies for those, and to sort of help weigh our universal goals while also really being specific about what communities need and what assets that they already have to rise to the challenge of meeting these really challenging decisions. There's really no good straightforward decision, especially in the schools topic. There will ultimately be trade-offs. And so how do we work collectively as communities to hear all the voices, make sure those that have the most structural and systemic barriers or sort of risks are lifted up and heard and weighed appropriately, and who has the current resources and assets to respond, and if they don't have assets, what are the creative ways that we can channel resources to be responsive? And I think that's where some of our principles that define and distinguish equity from equality are really important. In this scenario, it might not be that everyone gets the same, but really being responsive to local assets and opportunities to really engage resources in the way that makes the most sense for communities. And the flexibility and local leadership are incredibly important to lead conversations, especially as we sort of go up in levels of government. There's less and less coordinated response, right? So it's always important to engage local leadership. And right now, given our current context at the even county, regional, state, federal region, and then the federal level, it's so much more important to engage in really honest and meaningful and tough conversations, because there's just no one single best answer for a lot of these conversations.
Yeah, and I would echo that the key thing is definitely talking to the communities and figuring out what their needs are, because they know better than any of us could ever say. That's kind of the key thing, is making sure that those conversations are being had in an open manner, for sure.
So that centering of the voices of people that are most impacted is definitely a health equity principle that that Match has utilized a lot in its work, and that's now becoming kind of part of our shared lexicon, right? And one of the things that I'm both hopeful and concerned about is that the shared lexicon is growing, but the distance between the shared lexicon and the implementation of the words that we use, I think we've got room to grow. And so when we think about if we were to ask the people that are experiencing obstacles, what would they say? If we think about the frontline workers who have to go into workplaces that aren't providing or don't have the access to the appropriate PPE, and that's what workers say they need. I think this leads into Jonathan's question in the chat box. How receptive have policy actors in these respective domains been to the message? So how much have we seen the willingness to actually listen to frontline people's experience and translate that into real policy change? And what else can we do to make that that value and that principle really the standard practice?
Yeah, Sheri, our golden question, right? How do we actually operationalize centering voices and leadership of those most impacted by inequities authentically, right? Because I think the other challenge, as you said, once language becomes widely used, it's not always implemented genuinely, right, and with authenticity, and not without good intent. I think lots of folks that bring good intent to these spaces, and it takes investment of resources in local leadership. It takes investment in time and space, and that's been a real challenge in this pandemic. If you are a local government trying to address the pandemic and you haven't yet had the opportunity to build strong, trusting relationships with folks most directly impacted, and those folks have not had the opportunity to be organized and mobilized and build their own leadership, there's a huge risk for tokenization and coercion, and not, again, without good intentions all around. So I think some of the things we've tried to do is really support groups that are already organized in this time and continue to seed investments around community leadership and create as equitable channels of communications as possible, which for us has, I think within Match, our hope is to always engage deeply and do our best to channel resources. And we've had to move very quickly in a time of a lot of uncertainty and a lot of demands on resources, which has made resources scarce in some places. So we've had to walk a fine line between, do we engage very directly with communities most impacted who are already experiencing multiple stressors, with, what might be a group that can appropriately in this time speak on behalf, right? And really suss out with us what's our best path forward in a time that's not ideal. So I think we've done a range of work. We've been able to be partners to coalitions around migrant and seasonal workers. We've been able to partner with really strong domestic violence advocates in this time. There are really strong advocacy groups around individuals with disabilities, and then always seeking to improve the ways we reach authentically those most impacted to assure that we're channeling resources and making decisions in a way that supports those particular experiences. And it's always a challenge outside of the context of a pandemic, and it's been really testing our abilities to be nimble and flexible and aspire towards an ideal while also just needing to make the best decisions that we can possible in a dynamic that has that's really rapidly changing.
Thank you. Yeah. Lakita, would you add anything to that?
I agree with that. And I can't speak for all tribal communities by any means, but one of the biggest things within the community is in terms of collaborating and working with organizations relationship building is key. And so there's been a lot of mistrust of government. There's a lot of nuances with working within tribal populations if you've never worked with them. Those things are typically initial barriers, I want to say, to working with the communities that I'm aware of. And how do you necessarily navigate that in a time where, like you said, Paula, you need to move quickly to try to get these resources out? I don't know that there's necessarily a specific way you can do that quickly, other than trying to approach tribal communities in a genuine way and explaining like what those resources are and how they could potentially be used by the tribal communities to benefit their populations. And again, the key of that is making sure that the conversation is working with the community, in collaboration with the community, and trying to make sure those resources are being spread out among the community in an appropriate manner. But it's really challenging, even for individuals who've worked with tribal communities for a long time. There's this understanding that it moves slowly because you have to move through those avenues of the tribal governance, as well as working within the specific health systems of that place. So whether that's IHS, or if there's another, so for example, the Ho-Chunk Nation is able to move and rapidly do what they do because they also have, they provide a lot of their own funds for their community and their healthcare. And by providing more funds, they have more say over doing stuff quickly, rather than just going through the government with the IHS funds. So,
yeah, thank you for that. So what I'm hearing from both of you all is that having these strong relationships and partnerships in place before a crisis is critical if we are to actually implement strong community engagement in the midst of a crisis. And I know that the Global Health Institute and its expertise in climate change sees the overlapping crises, including not just this current COVID pandemic, but also the ongoing crisis of climate change and the ways in which strong partnerships in advance of what are certain to be additional climate emergencies are going to be critical for all of our well-being. So let me move to the chat box because I see a really interesting question from Jennifer Bird. Let me scooch up a little bit. And basically she says, are there avenues currently in place for having stakeholder conversations, which is sort of what I'm alluding to? Do state policymakers or researchers have existing relationships with community leaders? And then I saw a third question about how do we, from Dave DC, I always want to say it the wrong way, but I know it's DC. How do we best leverage the current political divide to better assure equity going forward?
Related to Jennifer's question, I think the quick answer is yes, and we can do better. So there are several, the governor's office rolled out a number of councils early in their tenure. So the councils that were stood up are channels for direct engagement with stakeholders. And there were, with the virtual space, they've been creative about town halls happening across the state with local communities. So there is infrastructure in place to have conversations, and I think we all know that those that often participate in those spaces sort of have a disproportionate advantage, right? So there's always more that we can do, but there are certainly structures, councils, town halls, and for us as a research institution have been partnering with many of our community-based partners for some over a decade, community-based organizations and organizing networks and groups. So we definitely invest in relationships over the long haul. So that has been our approach within our engaged research. And I will just say, as I've observed across state government, there's been a lot of channels for communication. Of course, always that can be better, but I do know the outreach staff well in the governor's office, and they've been busy making direct calls with local leaders all across the state that the governor himself has been on. So I do think there's a lot of effort to reach communities, get input across a wide range of channels, especially now that most of that is done virtually.
Mm-hmm. Yeah, and for tribal communities in Wisconsin, I would say that there are specific avenues in place to work with the tribal communities. Specifically, every single year, I know there's a State of the Tribes address, which occurs every year at the state capitol, where tribal leadership and governance from the entire, all 12 tribes across the state will come in and give an address on where exactly their community is on certain issues, as well as how the state can specifically help support those initiatives. The other potential avenue that can occur, I'm just going to plug the Native American Center for Health Professions here at the University of Wisconsin School of Medicine and Public Health. For specifically students, I know that they work with and engage with the communities all the way into the high school level, undergrad level, and then for me as a medical student now, as well as getting me rotations in the tribal communities across the state, and then even working with hopefully getting residents at the school here into those communities. So that specific organization works across the state with those tribal communities and is a good organization to work with in terms of starting conversations and dialogue with specifically their partners, that if it's something that they feel is amenable to what they already do. So I think that's a good avenue. As for Dr. Deasy's question, how do we best leverage the current political divide to better assure equity going forward? I feel like I have a really poor understanding of what we could exactly do. I agree with you that it seems like there is this huge divide of, like, one, we want to make sure that, or one, there is this inherent, like the words that you use, it's inherently designed to preserve current wealth and privilege. And then the other side is we want to have more equitable access and fair access to things such as healthcare and basic needs, such as like housing and all of that. I don't really know the best answer to this, because I feel like this is something we struggle with all the time in the United States. And I would think that utilizing specifically as individuals of higher education for ourselves, utilizing your specific organization like Match or this University of Wisconsin, utilizing that voice in the best way possible to advocate for communities of color across the state is at this point the best that I think we can do. And then working with those communities to also amplify their voices for what needs they have, I would think are the best things that we can do at this time. I think political division is always going to be there, and I'm not really sure the best way to necessarily navigate that other than kind of going with what we've already been doing and hoping, I guess that may not be the best answer, hoping that it's going to potentially work out in the end. That's kind of where I think is where we're at right now. I'm not sure if you have a different response.
Yeah, to think about that as well, in terms of the way that, for example, Policy Link talks about equity being the superior business solution, and the ways that Angela Glover Blackwell has written about the ways that when we approach health improvement with an equity lens, everybody wins. Talk about that for a minute or two, Paula, before we move toward wrapping up.
Yeah, thanks, Sheri. I mean, I think these I think our approach so far in Match has been to take a page from Policy Link and Angela Glover-Blackwell to really focus on where we have shared interests, right? Our communities are challenged by many of the same types of issues. They may manifest differently at the local community and require really specific solutions. But in general right now, this pandemic has especially shown that our destinies are intertwined, right? That it doesn't matter which county you're in. If your neighboring county is experiencing a high disease activity, chances are your county will too soon. So I think this pandemic has lifted up an opportunity for talking about our shared interests and ways that we can be collectively engaged in things that help us all, because we all do better when we all do better, right? So how do we ensure things that every rural, urban, suburban community is challenged with related to access to childcare, right? Access to good education, the ability to get to the resources they need when they need them, and that they're affordable, the ability to have living wage jobs, right, that are safe, and that they can get to. All of these things are challenges we've heard in every single corner of our state. And there's opportunity for us to come together around these shared challenges while leaving the flexibility for local communities to be able to tailor specific solutions. So a lot of the work that we've done in that space, including in the health and all policy space, speaking to Jonathan's question, has been to create a shared platform for shared interests and then make space for the necessary local contextual sort of tailoring to get solutions implemented. And for that reason, we've had a decently positive reception to policymakers from the very local jurisdictional level, villages and towns, all the way up to the state level, at least in opening a conversation about what our shared interests are, therefore what can shared priorities be, and how can we set the stage for channeled investments that allow local communities the flexibility they need to implement in ways that are responsive to their communities.
Thank you. So that, oh, go ahead, Lakita, I'm sorry. I was just going to sort of switch for the last minute or so to sort of what do we know about what works. So Population Health Institute has long had the What Works for Health database. We just shared a report on a compendium of strategies focused on social and economic conditions that might support a just recovery. And so when we think about things like childcare, that is a common cause that working parents and family members all understand the importance of having safe places for our children to learn and grow and develop the social, emotional, and intellectual skills they need for success. And yet, somehow we haven't gotten to that place where we see that common cause. And so I guess what leaves you hopeful at this moment? And I'm stealing that question from Paula because she always asks me that. So what in this moment makes you hopeful that we will find both common cause and common voice and leverage moral outrage, as Dave DC is writing in, but in a way that moves us toward the people that we want to be, and that builds off of the ideals that we have, both rooted in Native nations and their values and built upon as this country has evolved. 1 second. What makes you hopeful?
For me, it's obviously even being a part of these conversations. So Indigenous populations are usually left out of conversations like this. So I'm hopeful that by having us included in this type of conversation, that it will help propel at least our community towards change at some point and being a part of the conversation.
Thank you. Paula?
Yeah, I'll just say I'm excited about the leadership from those on the very front lines in our organizing spaces and our activist spaces, the Movement for Black Lives, and how they've come together with Indigenous organizing networks across the country to couple demands around change have been really keeping me going, and I'm really excited for continued investments in that work and lifting up that leadership and following the lead of activists and organizers on the front lines of the movement.
Thank you. Thank you both. I know we just went 1 minute over, and I think I was supposed to say something in closing, like, please remember this was video recorded and will be available. But please, Global Health Institute, thank you for organizing it, and please share any closing remarks that you would like to share.
I would just end by thanking all of you on behalf of the Global Health Institute for sharing your expertise, your time, for representing the communities that you do. And as a closing, I would just encourage everyone to register. We have 3 additional events coming up on July 30th, August 20th, and August 27th. The conversation will continue to grow from local to global, and we've got wonderful engagement and voices that will continue to be listed and lessons learned so that we can build back better as we move through this pandemic. So thank you to everyone, and have a great day.
Thank you all.
Thank you.